You good to go? Or?
Good afternoon, everyone. I am Pete Healy, President of Beth Israel Deaconess Medical Center. Today, we have had the opportunity to host Health and Human Services Secretary Alex Azar, Regional Director McGow, Governor Baker, Lieutenant Governor Polito, and Secretary Sutters. It has been a pleasure to show these leaders how the caregivers, researchers, and staff at BIDMC have stepped up day after day to respond to this crisis. Our committed and compassionate team has provided amazing care through very stressful times. They have, among other things, innovated to provide exceptional care on a disease not fully understood, held the hands of patients separated from their families, manufactured COVID test kits when none could be purchased, instituted measures for the safe care of all patients, and we continue to push the boundaries of research to develop a vaccine that could have an impact around the world. We are proud to host all of you today, and it is my honor to represent the staff of BIDMC. It's now my great pleasure to introduce Governor Baker.
Thank you, Peter, and Kevin Tabb and Secretary Sutters and Lieutenant Governor Polito. It's always good to spend time with you, and Secretary Azar, thank you for being with us as well. Before I start my remarks, to those of you in the media who are familiar with this, you're going to get my daily update on what's going on with respect to tests and hospitalizations. Yesterday, over 10,000 tests were reported, with 519 of them confirmed positive. The average positive test rate on that 7-day average, running average, is now down to just 3.8%, reflecting about an 87% reduction in the number and percent of positive tests since April 15th. That's obviously continued good news. And more than 675,000 individuals have been tested for COVID-19 across the state. The number of people who remain hospitalized due to COVID-19 is down to 1,334. That's a 63% reduction since the middle of April. And obviously these trends are the direct result of the work's been done by the people here in Massachusetts to distance, to wear masks or face coverings, to wash their hands, to clean surfaces, and to recognize and understand the importance of respecting the virus. I also want to say that over the course of the past several months, every day, the Lieutenant Governor, Secretary Sutters, and I have been on phone calls with Dr. Tabb and his colleagues at the major hospital systems across the Commonwealth. Every day since about the end of March, we had a call every morning to talk about the state of play with respect to the surge and managing COVID here in Massachusetts. And I was saying earlier to Secretary Azar that one of the most important elements of our success in managing our way through that process was the willingness of the hospital community and the healthcare community to basically break down a whole series of institutional relationships and to find a way to collaborate and work with one another to make sure that the right bed was available at the right time for the right person, irrespective of what system they started in, what hospital they came through, or whose ED they entered. And over the course of literally 8 weeks or so, as we managed our way through that surge, the hospital community here in the Commonwealth, this hospital, all the hospitals that are part of the BI Leahy system, and so many others really stepped up in a big way to make sure that they could not only manage and serve the COVID population that they were dealing with, but that they would also have the ability to take care of the other crises and traumas that people were dealing with on a more traditional basis with respect to healthcare. Which brings me to my second point. These numbers have gotten to the point where basically the entire healthcare system in Massachusetts is out of surge, with very few exceptions. And it's critically important, as we have opened up the healthcare system once again in Massachusetts to do other things, that people who need to access preventive services, diagnostic services, minor procedures, or simply reach out and go back and get their kids vaccinated or have that mammogram, that they do so. It's critically important that everybody understand and recognize that we have a healthcare system here in Massachusetts that's looking to serve people, has the capacity to serve people, and with the advent of telehealth visits, in many respects has more tools available to take care of and serve people than they did in some ways before all this began some 150 days ago. The third point I want to make is we also talked upstairs about some of the work that's being done here at this institution and at other institutions here in Massachusetts, some of which is in fact federally funded to chase a vaccine with respect to COVID. And I think it was announced yesterday that the feds are moving forward with a clinical trial process that will start in July, but there's a very promising platform that's been developed here at BI in conjunction with Johnson & Johnson that can, in many respects, provide a significant amount of optimism to all of us who are looking for both treatments and vaccines as a big part of how we, not only here in Massachusetts, but around the country and across the globe, deal with COVID-19 as we go forward. And the final thing I have to say is that my wife and I have 3 kids. They were all born at this hospital. And our oldest, when he was born, it was like many first deliveries, it was a little complicated. So when we left, one of the nurses in the nursery gave us a phone number and said, if you have any issues after you get him home, feel free to give us a call. And after 6 or 7 hours of being a parent on my own, I felt it was time to call. He felt a little warm and I was worried about him, so I called the number they gave us and they answered it in the nursery, and I said, geez, you know, I think he's got a fever, I really think I need to bring him back in. And the nurse on the other end of the line said, so how many blankets do you have him wrapped in? So I started peeling them all off, and I said, I don't know, 4 or 5. And she said, I'll tell you what, why don't you just take the blankets off, lie him down, and see how he's doing in 30 minutes. And that was, in some respects, my introduction to what I would call genius with respect to healthcare here in the Commonwealth and at this institution in particular. It's a great institution. It's one of many we have here in Massachusetts. And Secretary Azar, I just want to say to you, there is no better place in this country to come learn about what's going on with respect to COVID, with respect to treatments, with respect to testing, with respect to vaccines, and with respect to care than right here. And we really appreciate your being with us today. Thank you.
Well, thank you, Governor Baker, for welcoming me to the Commonwealth. We have just always had such a tremendous partnership with Governor Baker and his administration, and I really appreciate that Lieutenant Governor Polito and Secretary Sutters also came out for our visit today, so thank you for that. I also want to thank Peter and the rest of the team here. Kevin, thank you for welcoming me to Beth Israel Deaconess to just get to see the critical work that you're doing. This visit is a very important opportunity for me to learn about the success that Massachusetts has had against COVID-19 and the efforts that are being made toward a safe reopening. Thanks to the efforts of our frontline healthcare workers, and that means not just doctors and nurses, that means our janitors, our orderlies, everybody who works in these kinds of healthcare facilities and puts themselves at risk for the benefit of all of the rest of us. Thanks to all of them here at Beth Israel, thanks to the hard work of our state and local leaders like Governor Baker and his team, and thanks to President Trump's leadership, we're making progress against the virus every day. And today was a chance for me to hear about a particularly concerning aspect of the crisis, how measures that we need and needed to slow the spread of the virus may actually be impacting our health, including through drops in important healthcare services and what healthcare providers are doing to address that. The number of Medicare fee-for-service beneficiaries receiving in-person primary care services in Boston dropped about 80% from February to April. Thanks to creativity from providers and flexibilities that we offered at HHS, we've seen a surge in telehealth Primary care visits. I think I heard that of the visits here at Beth Israel Deaconess, normally they'll see 5,000 patients. Now they've got 2,000 in person and 1,000 that are telehealth, or the opposite. Is it the opposite? 2,000 in person, 1,000 telehealth. Really just a complete transformation in how care is being delivered. In the Boston area, we've seen colonoscopies and mammograms decline by over 90%. Joint replacements down by 90%, cardiac surgeries down by 70%. And Beth Israel Deaconess has been measuring and studying these drops themselves. Referrals here at Beth Israel for breast cancer and blood cancer are down over 60%. There's been a 33% decline in heart attack hospitalizations and a 58% decline in stroke hospitalizations. People aren't stopping having heart attacks and strokes because of the pandemic. What's happening is they're not seeking needed medical care. Now, we've supported healthcare institutions with funds that the President secured from Congress for healthcare providers, including more than $63 million sent to Beth Israel already. That included a targeted allocation to hospitals that are treating large numbers of COVID-19 patients, including this one. Despite what we're doing to support hospitals, emergency measures are no substitute for safely reopening our healthcare institutions and giving patients confidence that they can return for the care that they need. That's why we're supporting states, cities, businesses, and all parts of civil society with the information and tools that they need for a safe reopening. We've got to balance the health risks of the virus against the health risks of foregoing all of this necessary medical care, in addition to the health risks of social isolation and economic dislocation. The right way to think about reopening isn't health versus the economy, it's health versus health. This mindset also means addressing mental health and substance abuse challenges that can be exacerbated by isolation, which I'm going to be seeing and hearing about later today at the Gavin Foundation, a recovery center in Charlestown. I know Governor Baker has put a special focus on the opioid crisis. Really, from my first days in office, I've worked with Governor Baker on the opioid crisis with his leadership. Massachusetts should be proud that the state's drug overdose deaths are now down more than 6% from their peak. But the pandemic presents a risk of backsliding, and we have data suggesting overdose spikes in some areas of the country are happening. The President's top priority is the health and well-being of all Americans, and that's why we've got to be moving, as the Commonwealth of Massachusetts is, toward a safe and prudent reopening here in our healthcare facilities and throughout our communities. With that said, I know we'd be happy to take some questions, and the Governor and I especially will be happy to grab them. Yes, in the middle.
Secretary, as many as 20 states are seeing an uptick in COVID-19 cases, how much of a sense do you have about whether reopening is reinfecting the population at large?
Well, it's still too early to tell in terms of reopening or, say, Memorial Day, which is something people ask about. But we have about 60 counties that are what we would call hot spots that we are very much focused on. Most of those involve fairly discernible causes, such as congregate living or congregate work environments. So skilled nursing facilities or nursing homes, prisons, or meatpacking facilities or other settings where the disease can spread rapidly, and then associated possibly community spread. We are seeing, however, some other pockets of the country with increases in cases and hospitalizations, and we're actually deploying our officials from the CDC, our epidemiologists, out to get the ground truth, to find out what's going on there, to make sure that we can work with the state and local authorities with interventions. But at this point, in terms of a connection to reopening, the data doesn't seem to support that. At this point, it's still too early to draw that type of a conclusion from what we're seeing, but we need to not speculate at this point. We're going to get the data. Yes, Nick? Yeah.
Secretary, what is one critical thing you've seen in Massachusetts that you could bring back to Washington and say, hey, we need to do this as a common practice in other areas treating the COVID?
Well, I got to see a couple of things already this morning. One of them was here at Beth Israel Deaconess. They've been assembling testing kits, so putting together the swabs, as well as they have created their own transport medium. So you take the swab, then you have to put the sample in a transport medium to get it to the testing site. And they've actually been assembling that, which has, I think, been very creative on their part to enhance and add capacity. We've got now 22 million tests that we've done here in the United States. As the governor said, Massachusetts is now at 3.7% in the last 7 days of positive testing rate. The international standard for testing is you want positive rates of below 10% as just a rough index of if you're getting enough testing out there. But getting to see the great work they're doing to support their high throughput testing system here, the tents that they've got outside where they're testing their patients who are coming in for inpatient procedures or at-risk outpatient procedures, as well as testing staff as need be, and even community-based testing. So that's been important to see. I also got to really hear about the important innovations in telehealth. So I got to be with the primary care practice here, and just the immediate innovation in delivering care by telephone, by FaceTime, by Skype to patients who can't come in. It's going to change how we deliver health care for the future. But I want to encourage people, that's great, but you got to get in here. You got to get into your healthcare providers to get the pediatric vaccinations, get your diabetes taken care of, get your cardiovascular and cancer screenings. You've got to get into that. There's only so much we can do by telehealth. Thank you. Let me go to the blue in the front here.
Thank you. How soon, realistically, do you expect we could see a vaccine?
So we have set a goal, an ambitious goal of early next year for having 300 million doses for the American people. Now, that's a goal. There's no guarantees when it comes to scientific development. That's, in fact, the experts right here at Beth Israel Deaconess will tell you that. President Trump was confronted by the drug companies' timelines and found them to be unacceptable, because normally what drug companies do is progress stage by stage and have time delays in between each stage, and then scale up manufacturing once one has a product or a vaccine. What we're doing is deploying the entire power of the federal government, the financial resources of the federal government, and our incredible private sector. You know, Cambridge and Boston here, of course, one of the great biopharmaceutical centers of the world, harnessing that to advance all those timelines, never compromising on safety or efficacy, but rather reducing inefficiency in the development timelines of those drugs. You've seen announcements, just the J&J Janssen vaccine, which is in partnership here with Beth Israel Deaconess, has recently announced that they've already been able to compress their timelines to move from originally a first human patient visit in September to now coming in the next month. That's an incredible advance, pulling the inefficiency out of the system, and at the same time, what we're going to be doing is going at risk and manufacturing vaccine even before we know if we have safe and effective vaccine. That way, if we get FDA approval of a drug or authorization of a vaccine, we will have the product ready and available to administer. So these are credible goals. We're going to have many shots on goal, but there's, of course, no guarantee with science. In the back in the white shirt.
Mr. Secretary, the mayor of Boston today declared racism a public health emergency. Would you agree that it is?
Well, obviously, racism is a critical issue for our country. We've all witnessed the grotesque death of George Floyd. And we have taken steps in the healthcare world. My department actually played a critical role in desegregating healthcare facilities, actually. We have tremendous healthcare disparities in this country based on race and ethnicity in terms of access to healthcare. And so we've worked just actually this week, today, we've delivered $10 billion of money to hospitals that have a disproportionate focus on caring for the underserved. Beth Israel Deaconess received $33 million today as part of that. We have our community health centers, which have delivered over 800,000 tests for COVID-19. The majority of those clients are actually from minority communities. We have community-based testing that we've set up. The first community-based testing site actually was right here in Massachusetts in the Boston area. And the majority of those community-based testing sites are actually to serve in socially disadvantaged communities. And we last week have required that all COVID testing provide demographic information so we can get a better understanding about the disproportionate impact that we're seeing of COVID-19 in minority communities to help us with research and understanding so that we can better prevent and treat there. Let me up here.
Do you believe Massachusetts has the tools at its disposal now to address a significant outbreak if one should happen in a manner that avoids a total economic shutdown responsibly?
So We do believe that we have the tools now to avoid these types of shutdowns again in the future, certainly on a national level. Now, that's not to say there could be isolated communities that will face outbreaks that need to take some forms of community mitigation steps in the future. That'll be locally led, state supervised. We'll provide support at the federal level. But we've really, as we think towards the future, be thinking of really a six-part approach to it. Surveillance, and this is something that we've really been able to build together, the states, the locals, federal government, together with President Trump and the team leading this, is surveillance systems. So first, you have a very deep influenza-like illness surveillance system in this country that will look for any early indicators of individuals who are experiencing COVID-like symptoms. You test all of those people, so get them all tested. Connected to testing, you also test certain communities that are most at risk, whether it's nursing homes or prisons or meatpacking facilities, maybe schools. You test them for asymptomatic transmission, so that's surveillance testing that you'll do. Third, when you find cases, you do traditional blocking and tackling of public health. You revert to a containment strategy where you are identifying cases, you're containing them, you're isolating individuals, treating them, contact tracing who they've been in close touch with, and doing the same there. Then you have health system capacity and supplies. That's, of course, a critical issue here in Massachusetts from the experiences that we all went through, making sure that we've got adequate supplies. That's part of the next generation strategic national stockpile to build up a 90-day supply of 100% of the products that one would need in the event of a pandemic. And then fifth, getting therapeutics. We've already got one therapeutic authorized. We're doing clinical trial testing and many more as part of Project Warp Speed. And then six, as we mentioned, vaccines. So, in the back with the mask on. Yes, gentlemen. Well, let me do the gentleman, then I'll go to you next. Thank you.
How concerned are you with the peaceful protests that are going on around the country? How concerned are you of an outbreak? And what is your advice, even here in Massachusetts, to the governor? They're not social distancing. They are wearing masks, but they are very close quarters. What are the chances of another outbreak happening? And how concerned are you? And when would that happen? Will those numbers start to reemerge?
So first, I want to emphasize that peaceful protesting is a vital part of our American democracy, and we've got to support that and defend that. And that's really part of our fabric. I do encourage, as a public health matter, of course, individuals exercising those rights to think about themselves and their family members and protecting them. So obviously we would encourage social distancing. We would encourage the use of facial coverings to protect others and for the others to protect them in those types of situations. In terms of any impact from protest activity, it's still probably too early epidemiologically to be able to draw any conclusions there connecting to any particular type of activity. You're looking at on average about a 5-day incubation period, but then people are going to be presenting with symptoms at some point. Then they would get tested. In terms of spikes in hospitalization, it could be anywhere from 2 weeks to 4 weeks that one might be looking at any impact on hospitalizations there. I know Director Redfield from the CDC has suggested that individuals who have been in a position where they were unable to appropriately social distance and were not wearing facial covering, that they should consider and think about getting tested. So I'll just repeat what the director of the CDC said. But these are still important activities that we have to support. Now, in the red blouse, yes.
Secretary, given what you know now, given how much Massachusetts has had to invest in its nursing homes, work with its hospital sector, how much the state struggled to obtain PPE while competing with the federal government, what should you or your colleagues in the White House across the administration have done differently, looking back throughout this pandemic?
Well, this was a truly unprecedented circumstance. A novel coronavirus like this, a highly transmissible but very severe disorder that spread, now we know, no thanks to the Chinese for concealing it, asymptomatic transmission that makes this a particularly perplexing and dangerous virus to be dealing with. What have we done? We had to build a completely new testing system in this country because this country did not have a system for standing up testing of a novel pathogen. We had flu testing. That's why when we have flus, we're able to do testing because we have a system, public-private partnership for influenza. In the past, when we would have, say, Zika, which Beth Israel Deaconess has done a lot of research on, something like a Zika, The CDC could develop a test. It's a very manual test. Public health labs could do that, and eventually the private commercial lab system might develop a test for that, but that's small, more isolated outbreaks. An immediately national pandemic novel outbreak like that has required us to really build a large public-private partnership that's now has delivered more tests than I believe all countries combined, and achieving those world rates. The stockpile and personal protective equipment. So the Strategic National Stockpile has always been meant as a backup, largely focused on bioterrorism and chemical countermeasures that only the government would purchase. The personal protective equipment in there has been more for localized situations. President Trump now has said he's not going to let that happen again for any other administrations. We have a next generation Strategic National Stockpile focused on having 100% of the products needed for a pandemic. It had 28% when we inherited it, making sure that it has inventory for a 90-day backup supply. But of course, states, locals, private sector have to be on the front lines. They have to responsibly build up their own surpluses. They can't do just-in-time inventory. I think that's been a real wake-up call for our healthcare industry. And we would work through the private sector distributors to manage that inventory on a going forward basis. So we're building that up right now as part of that next generation stockpile. Let me in the black there. Yeah, in the black.
Secretary Azar, how does the federal government envision its relationship with public health organizations like the World Health Organization and the CDC going forward, knowing that there's been some fallout there?
Oh, well, the CDC is the federal government, so the relationship is quite intimate between the government and CDC. In terms of the World Health Organization, the President has made it clear that we intend to leave the World Health Organization because the World Health Organization has failed in its responsibilities to demand accountability under the international health regulations, to demand transparent communication and full access to viral samples by a certain country. We have, however, made clear that the World Health Organization can take steps to demonstrate its independence from China, its commitment to reform, its commitment to ensuring accountability in terms of transparency, investigation of the original causes and origins of the outbreak, and reform of all of its procedures in emergency situations, that we continue to talk to the World Health Organization, and there's pathways there, but absent change, we are going to leave the World Health Organization. Okay? Thank you all very much. Appreciate your coming out today.
I don't know that you've had anything to say that I'm aware of with respect to a while back, the arrest and indictment of a cancer researcher from this hospital trying to smuggle vials of bioresearch into Wuhan. And if you have any thoughts about whether security around that type of work here has been stepped up since, and whether, despite all that's going on, the work to come up with a virus and deal with the coronavirus here, perhaps down the line we may learn that someone from here may have played a role in getting materials over to Wuhan that may have had something to do with the genesis of the virus, if in fact it turns out it came from a lab and not from a wet market and from bats in a cave.
Well, that seems like a pretty far stretch, and I wouldn't want to add any kind of conspiracy theory to that. But all of the Harvard hospitals and other labs across the state, we all stepped up our measures to ensure that scientific collaboration, while still supported and endorsed, that we added additional regulations to that. In terms of the matter with the one researcher from here, that was taken over by federal authorities with all of our cooperation, and has not led to any issues on our side here.
Is that the first
We've been around. Thank you all very much. Appreciate it.
Governor Baker,
Thanks, Governor. Good to see you.
we've been hearing from breeders that they've been having trouble getting testing different places. The rules are pretty restricted on when they are allowed to get tested, whether they need to have certain symptoms. And just wondering what your administration is doing to try to clear up that confusion for people and make sure that testing can happen.
I mean, generally speaking, the rule of thumb is pretty simple, which is if you have symptoms, talk to your provider and there is not a supply. We don't have a scarcity issue with respect to tests. Get tested. As Peter said, basically anybody who ends up being admitted to one of our hospitals in Massachusetts is being tested almost as a standard matter of course. We continue to test on our side on a regular basis, nursing home residents and staff, as well as people who serve vulnerable populations and vulnerable populations themselves. And if you're somebody who's had any kind of close contact with anybody who's tested positive, you should be tested as well. And I guess what I would say is that, generally speaking, the aperture at this point is pretty open. I mean, when it started, there were a series of criteria associated with testing, and they were ands. You know, you needed to have the following 6 or 7 things, and. The testing protocol at this point is pretty much an or, and there's a lot of discretion there for clinicians, a lot of discretion.
What does the state need more of from the federal government right now, and did you share that with the Secretary today?
Well, we talked a lot about the issues around vaccines and treatments. I mean, we've been saying for a while that the feds have more tools available to them to put the foot on the accelerator with respect to treatments and vaccines than anybody else. Not only do they oversee the approval processes, but they also have resources that are specifically oriented to be invested there. And I'm glad to see that they're now doing some of that. We've also made pretty clear to the administration that while they have used a series of fairly traditional mechanisms to determine how they were going to distribute funds associated with the CARES Act, net patient service revenue, Medicare fee-for-service, Medicaid revenue. Those are all good and everybody understands them, but they really need to come up with a strategy that delivers resources to those providers who serve the largest number of COVID populations. And that would be places like this and places like Massachusetts.
Last question. The Secretary was asked about the PPE and how it was so hard to get during the pandemic. Curious, did you ever find out why the shipments to Massachusetts were allegedly intercepted, or did the Secretary tell you that won't happen again if we see another surge?
There are many states and many providers that had shipments of one kind or another mysteriously disappear. And I accentuate the word mysterious. There is no real answer for us or for others with respect to what actually happened there. I can tell you that part of the reason why we created a program here in Massachusetts to encourage manufacturers to pivot and start to make PPE is because I want to make sure that we are growing a lot of our own PPE here in the Commonwealth on a go-forward basis, whether it's gowns or gloves or masks or coveralls, because it's going to be critically important on a go-forward basis that one of the big lessons that we learned from this is that we do need to be able to touch and feel big parts of our supply chain when it comes to a lot of these issues. And I've also made clear to the feds and to others that I don't think in the long run, and Secretary Azar has said some positive things about this, that whole idea of a global supply chain that operates on a just-in-time set of principles when it comes to something like this doesn't work. And we're absolutely going to make sure that we have domestic supply chains that we access and support for healthcare providers here in Massachusetts around PPE for just that reason.
Are you optimistic it's finding a vaccine as the Secretary was at the beginning of the year? And the second question is, how concerned are you with the outbreaks with the peaceful protests going on with the surge?
So anytime you have big groups together like that, especially if there's a lot of singing or chanting, which there was, that's concerning. I'm taking some comfort from the fact that it was outdoors. Most people were wearing masks, and those groups, for the most part, were moving. You know, the ones that were marching, in some respects, were moving throughout that process. But I think his analogy about, or his representation about how long it's going to take to really see the impact of this was probably about right. That'll probably be a couple weeks from now before we really know.
Governor, would you agree that racism is a public health emergency, and would you consider moving part of the state police overtime budget as the mayor has done in Boston?
So I can't speak to the state police budget piece. You know, I'm not a big believer at the end of the day that the right way to solve a number of problems is to so-called defund the police. I do believe in more accountability and transparency, and as I said yesterday, we'll be filing legislation on that next week that we've been working with the Black and Latino Caucus on for quite a while. If you think about criminal justice or housing or transportation or healthcare or education, so many issues, there's no question that communities of color have been disadvantaged. And we've done things to deal with these in many cases, and we're going to continue to do things to deal with these. But these issues are real, and as I said in my comments yesterday, I was glad to see so many people suddenly decide that it was time for us on Beacon Hill to get some stuff done on this.
Thanks, guys. Was there any discussion about the timing of your reopening with the secretary? Did he say too slow, too fast? I know that you...
I think he's smart enough to leave that up to the local points of view to make decisions about. I'm pretty sure that ours so far is too slow and too fast, based on a lot of the incoming that the Lieutenant Governor and I get from many folks. I will say this, the whole point behind doing a phased implementation of reopening was so that we would have the ability to continue to check data associated with those key elements that we publish every day, to make sure that if something did happen, we would be in a place to address it. That's why we were the first state in the country to put up a contact tracing program. It's why we've been so aggressive about expanding our testing capacity. But there's no question in my mind that a cautious and careful reopening based on data is ultimately our best way to ensure that we don't end up creating a second outbreak. Thanks.
Everybody. We gotta